Hi,
Yeah.
everybody. I'm Lisa Tversky, co-chair of the upcoming NEFISH International Conference. And here with me now is Dr. Ricky Greenwald, who's a psychologist, founder of the Trauma Institute, leading EMDR expert, and originator of PC, which, for those of you who don't know, stands for Progressive Counting. And he's going to be at our conference. We're so lucky to have him for a full day workshop as well as a shorter workshop. The full day workshop is entitled Slaying the Dragon, PC, and the Fairy Tale Model of Trauma Treatment. And the half day workshop, or the shorter workshop, is Intensive Trauma Focused Therapy. So Dr. Greenwald, let's jump right in and find out what we can expect to get from these two workshops.
Okay. Thank you. The main event is that we have trauma healing now. Really, for the first time in history, we can tell somebody, if you do the work, chances are really good that you're going to heal. We have systematic, efficient ways of getting it done. EMDR is the best known of those, and there are other methods like PC is a newer method that seems to be even more efficient. There are other methods as well. So the full day workshop, the fairy tale model of trauma treatment, we're going to go over how to organize your treatment approach so that your clients are going to be ready, willing, and able to do their trauma work. And this is going to be appropriate for people whether you're already trained in one of the trauma resolution methods or not. It's a framework for organizing existing skills, and you'll also walk away with a few new ones in terms of how to explain to your clients what's going on with them, sort of how to analyze a case from a trauma perspective and how to problem solve a case from a trauma perspective. So people who are already trauma therapists, I think this will help you to get more of your clients to be ready, willing, and able to do the trauma work. And even if people aren't already working from a trauma orientation, this will help you get started.
Wow. Okay.
The shorter workshop, Intensive Trauma Focused Therapy, is for people who are already trained in an efficient, effective method such as EMDR or PC, or another one. There are a few others out there.
Right.
And this is a very cutting edge treatment approach, which is to get it over with this week instead of this year.
Okay.
Clients really like that idea. Nobody wants to suffer longer than they have to. Cuts total treatment hours way down because you're cutting out all the hello and goodbye, and you're cutting out most of the coping skills that they're not going to need after they're not traumatized anymore. It's a very exciting treatment innovation. It's all we do in our clinic. We've got good results. There's other research on it as well.
Wow.
And so I'll be really explaining what it is, why it's so great, not for everybody, but for many people, and how to do it.
Great.
For
Wow.
people who are already trained in, for people who already know how to do the trauma work, how do you organize treatment to do it all at once?
Right. And you kind of alluded to it. It was my other question that I was going to ask was, are we talking about trauma, the range in these two workshops, or specific categories of trauma that are either or both of the workshops that are more amenable to what you're talking about versus other categories that are not? Are you going to make that in the workshop? Should we know about that before?
Methods like EMDR don't care what a psychologist calls your trauma.
Okay.
If it hasn't been processed or digested yet, if it's causing a psychological wound, if it's causing dysfunction, methods like EMDR or PC can help you to process or digest that. And so I use a very broad definition of trauma to be anything that caused an emotional wound that's still kind of stuck and causing problems. And in fact, if you look across the range of presenting problems, they are virtually all trauma-based.
Right.
That the primary symptoms across presenting problems are all post-traumatic stress symptoms: depression, anxiety, avoidance, anger, reactivity, worrying. So,
Right.
and it turns out also that trauma therapy clears up those symptoms. So,
Complex trauma versus
yeah,
other
yeah,
types of trauma.
yeah.
We're talking about the range.
Obviously, complex trauma is going to be a longer treatment
Mm-hmm.
than simple trauma, and every client is different, and they're going to need some more of this or some more of that.
Right.
In a trauma-informed therapy approach, you don't only do trauma work, you also still work on skills and behaviors and life situation and all that stuff.
Right.
And every case is still different, but you can use a trauma-informed treatment approach as a generic treatment approach, incorporating the other interventions you might need to use for that specific case.
Right.
So this is not only about PTSD, simple or complex.
Mm-hmm.
It's really a generic treatment approach because trauma, broadly defined, causes or exacerbates most presenting problems.
Got it.
So it's important to treat that piece of it.
Mm-hmm.
Rather than struggling with coping with post-traumatic symptoms, it's
Mm-hmm.
better to heal from the trauma and not have to cope with those symptoms anymore.
Right. Right. Okay, well, thank you so much for letting everybody know what they can expect. I think that people are going to walk away, it sounds like, with a tremendous amount of knowledge from the full day. And for those who are already EMDR or PC or other based, solidly in trauma treatment, in a trauma treatment modality, this is very intriguing, this intensive trauma-focused therapy notion of organizing and rapidly moving through rather than spacing out the treatment. That's very intriguing, actually. I can't wait to hear more about that. So I look forward to seeing you and all of you in just a little while, a few weeks at this point. Thank you so much for your time. I really appreciate it. Thank you.